This afternoon, we're hosting the Village of Hope Center, a non-governmental agency that houses all kinds of children from diverse backgrounds. Before they join me in the studio to talk about their planned activities for the year and how they're seeking to raise funds to take care of the kids in their care, take a look at what the Village of Hope has been doing since its inception years ago.
My name is Fred Asari, and I am the Managing Director of Village of Hope. Currently, Village of Hope is made up of 6 separate ministries that work together. The first is the children's home called Hope Children's Village. Village of Hope is currently caring for 260 orphaned, abandoned, destitute and needy children. We feed them every day, we clothe them, we provide them with education and with health care, and we see to their spiritual development. Village of Hope does not advertise to have children brought here, but people who know about Village of Hope would send in requests for children to be helped. When we receive these requests, we investigate each case. Once need is established and there is a vacancy at the Village of Hope, then that child is brought in to the Village of Hope. Village of Hope has children from all over the country. All the tribes of Ghana are represented on our campuses, and we care for children irrespective of their background. If need is established and there is vacancy, we bring in the children. The next is the academy called Hope Christian Academy. It has children from pre-kindergarten all the way to the 9th grade and has about 740 students. There are over 12,000 elementary schools in Ghana, but only about 600 high schools. This means that every year, more than half the kids who graduate from elementary school are not able to go to high school because there are no vacancies for them. To be able to select who goes to high school, the government of Ghana has instituted a national exam to all 9th graders in the country, and only the top 50% are able to move on to high school. To be able to ensure that our children from the Village of Hope were able to go to high school, we had to make sure that they passed the national exam and got the grade that would enable them enter high school. But the schools in the community were not able to provide that education for the children of the community. And so we decided to have our own school. That is how come we started Hope Christian Academy. That school was also open to the community, so that children from the community can attend school at the Village of Hope. Every student who has graduated from Hope Christian Academy has been able to go to high school. Because of that, many people who want their children to have good Christian education have brought their children to Hope Christian Academy. We have therefore begun a boarding school system with about 200 children. Right now, the school has 2 departments. The nursery school department is made up of 2-year-olds, 3-year-olds, 4-year-olds, and 5-year-olds, up to kindergarten. There are about 120 of these children. 1st grade through 9th grade is called the basic school department, and that has over 600 students. Hope Christian Academy has been adjudged by the state as one of the best elementary schools in the central region of Ghana and one of the best elementary schools in the whole country. Then we have the hospital called Hope Christian Hospital. Average attendance is about 80 patients a day. It has a theater with surgery, and there are about 30 babies delivered at this hospital every month, which means every other day, 1 baby is born at the hospital. The hospital has a full-time medical doctor and about 8 nurses. It has a pharmacy with a full-time pharmacist and his assistants. It has a laboratory, it has a dental clinic and an eye clinic, serving about 20 communities.
So that's a little bit of information for you there about Village of Hope. I have 2 of their representatives here in the studio. Araba Amoisi Ejay, she's the Deputy Group Managing Director for Administration. Araba, you're welcome.
Thank you.
And I also have here Kweku Sarkodie, who is also the Deputy Group Managing Director for Marketing. Mr. Sarkodie, you're welcome, and a Happy New Year to you both.
Happy New Year. Thank you for having us.
You're welcome. So let's try and understand a bit more what the orphanage does. Where do you get the kids from, first of all?
Okay, so basically, the social welfare would recommend and then bring kids to the orphanage. Okay. So social welfare departments across the country would find a good home for us to take care of the kids. So the Central Region Social Welfare would go around and then determine whether our home is the best place to bring kids. So they do the recommendations. Occasionally, we have children who are brought in by other people, not directly related to the Department of Social Welfare.
What's the background of these children? I don't know, any of you can take that question. Are they, you say that the social welfare can bring someone in, so maybe someone who has been taken away from their parents, or someone who was just found on the streets. What's the nature and what's the background of the children who come to you?
Basically, they are orphaned, destitute, needy children. So they could be single orphans, they could be double orphans. Single orphans being those who have lost only one parent, double orphans being those who have lost both parents. Street kids are also brought to our home as well. So it depends, but basically orphan, destitute, and needy children are brought to the children's home.
Okay, I just want to understand, sorry, so I was having a little bit of a problem there. I just want to understand the nature of the kids who come, and so that determines how you take care of them. So a child who has lost one parent, why would they become your burden? Because they have their other parent to take care of them, isn't that right? And it's always the best to have them in their familiar settings, yeah.
Okay, so basically orphanages are the last resort when it comes to taking care of their children. So social welfare will determine whether a child has to come to the orphanage or not. Okay. In determining so, they have to do what we call need assessment. The child, what is the need assessment? Is the child vulnerable? Okay. If the child should stay with that single parent, what will happen? There are certain children, if they stay with their parents today, they may not even eat the whole day. So we don't determine who should come to the orphanage. If social welfare thinks that the child in question needs residential care, they would bring that child. Okay. But in most cases, it's only total orphans, trafficked children, abandoned children that do come there. The single ones, they don't normally come there regularly. Okay. In most cases, total orphans and then trafficked children and all those.
So what is the history of the home in terms of developing these children from the stage they're brought in to, you know, wherever? I mean, what's the story you can share, the story of pride, if I should put it that way, that you can share in terms of, you know, how you have you moved these children? Like, is there any such story?
Oh yes, there are many success stories. So we have children who are brought in, let's say as basic school children, and you know, from our system we have a school. So the kids come in, whatever age you come in, we fit you into the level that you're at. So basic school, then you move on to senior high school. We take them all the way through to tertiary. Okay. Then there are kids who are street kids. They have family members far away elsewhere, but they need to learn a trade to get them off the street. So we have the Street Kids program. They are residential for a period, about 2 years. They learn a trade. Yes, so they learn a trade, sewing, dressmaking, hairdressing, auto mechanic. Then we give them the required skills, and then we give them the tools they need to set up their own facilities, and then they leave. They go. Yes, so they are off the streets. Then those who stay in the homes long term and go all the way to the universities, they finish universities, they are working in several places.
So you have people who are like who have gone through your system and are like working now.
Oh, yes. We have people working in Calbank. We have people.
Oh, that must be very fulfilling.
Oh yes, it is.
You should have brought some of them here today.
Some are even MP elect.
Yes.
Oh wow, who? Is it MP elect for Medina?
Yes.
Oh, Francis Xavier Soso.
We are so proud of him.
Yeah, you should be. You should be. Now that's a great story. So Francis Xavier Soso is a lawyer. He happens to be a street kid who was brought into your care. Is that the story?
Yes.
Orphaned. Yes. And was brought into your care. Yes. And now he's a member of parliament. Like before that, he was doing some real great jobs. He was doing a lot of pro bono for people, especially with human rights abuse cases. So what are the challenges? I assume there are a lot.
So basically, our challenges are financial.
Yeah.
Well, they say money does everything. I know. If there's money, they say the child doesn't cry in the morning. Yes. So when we have money, we will be able to take care of the children. At the moment, we are taking care of more than 200 children. Okay. About 40 are at the senior high school. about 35 are already at the tertiary, university, polytechnics, and all those things. As I speak with you, 15 have gotten admission to the university. So adding them to the 35 already is 50.
Wow.
And then the residential children are up to 70 and above.
I mean, in 2008, I did a little bit of volunteer work in an orphanage in Bando. And I mean, it was just a few kids. This was an HIV/AIDS, so people who have been orphaned because their parents had HIV and AIDS. And trust me, just a few, but it wasn't easy. Yeah. So I can imagine with the number that you're mentioning, the difficulties that you have to go through. What is the source of funding, the traditional source of funding? What has it been? Donations?
Donations, and then we speak with companies across the country, both locally and internationally. And so basically, donations to run the orphanage, donations.
Okay, how are you? We're entering a new year, and so let's talk about the plan for the year in terms of revenue generation to take care of the home.
So Village of Hope will be 25 years in February.
Oh, wow!
And so as part of our celebration, we are urging people, individuals, companies, and especially individuals, just give us 100 Ghana cedis a month.
Okay.
To be able to take care of these orphans.
So you're looking at a situation where the organizations would sort of commit monthly
amounts. Yes.
Okay. Okay. And 100 cedis a month for how many companies?
No, individuals, companies, groups of friends, so that a fixed amount. We know we have this to work with for the whole year and then other years.
Okay. So how was Christmas like? Christmas and the New Year. How is it like in the home? I wish you had brought some of your kids around.
Well, if you had told us earlier, we would have
brought one or two. Because of the COVID, we didn't open up a lot.
Okay.
But people came there, visited.
To donate.
Yes, donated. And then, because of COVID, since March, we've not had a lot of donations. Yes.
That's another hard one, isn't it?
So this year, we are praying that the COVID problems will go away so that our kids can have a lot of people to visit them and also donate to them to be able to take care of the little ones. Because we tell people, you think they are orphans, you are not remembering them.
Yeah.
Tomorrow, if they are hungry, they will not go to another orphan. When they pick cutlass, when they pick knife, they will go to somebody who is rich. And so why don't you, all of us, as a country, as a society, look into these orphans and take care of them? So that if your son is at the university, and he's also at the university, if your son is eating, he will also eat. And he will not think about anything bad to do to the society. That is our prayer and our hope that this year people will look at Village of Hope and say, I want to adopt a child. By way of sponsoring one child, at least Ghana's 100
cedis a month. 100 cedis a month. I mean, 100 cedis a month is 100 is like someone's lunch.
Yes.
So 100 cedis a month, that should be fine to support a child through. So something that you can be proud of in a few years. You can look at point to the person and say, I supported this kid. Or you can look at a Xavier Sosu and say, I supported this kid and I made him who he is today. So for Christmas, do you organize in-house, activities?
Yes.
Tell us a bit about. I would have loved to hear this from the kids themselves, but tell us a bit about that.
So every year, because our system runs as a home, the kids are in a home with a married couple, so they live as a proper family. And so the
family
older
with
one,
200 children.
No. Every home and then a fixed number of children.
Okay.
So a home with say a couple and say 20 kids. It's one home. So several homes on the campus.
Okay.
So every year, all the kids who have passed through the orphanages and have grown up would come home. We have a homecoming session. So every December is homecoming. And it's fun on campus. So the older kids come, those in the university, senior high school, they all come. And then we have activities planned for the week. And the grand one is usually the 31st December, where we have our crossover.
So you did a crossover last night?
Oh, yes, we did.
How did it go?
Oh, very well. We slept around 3 a.m. After the crossover, we did what we call Jama praise.
Hey.
We're praising God through the Jama way.
Yes,
that's nice. So how can people support? Apart from, if I want to do the 100 cedis a month, what should I do?
You need to make a pledge. You can call any of our numbers. We'll send you the...
Let's go through the numbers.
Okay.
Yeah. I'm waiting.
020
201
201
2229
2229. Yes.
Yeah.
024 4
4
313
313
404.
404.
Yes. So those are main numbers.
So you can call and then you take a pledge of the 100
or we'll send you a link to the pledge form and then you can make a pledge.
I'm assuming this is also mobile money.
Yes, we have mobile money.
These are mobile money numbers. Yes. Okay, so I'm just going to go through the numbers for you, just in case you want to, do something nice this Christmas and this New Year. It's 020-201-2229. Very simple. 0202-102-229. Right? 0202-102-229 and 0244-313-404. 0244-313-404. The Village of Hope. That's where lawyer Xavier Sosu came from. He's been a lawyer, a human rights lawyer who has been doing a lot of pro bono cases. Now a lot of landmark human rights cases has been handled by him, and now he's won the Medina seat going to Parliament. That's a great example, and it tells you just how much your 100 cities can achieve if you put it in. Now, personally, contribute, and I urge you to do so as well. Let me take your very final words. Let me start with you.
We just want to wish all our donors, our visitors, everybody that have made Village of Hope what it is today, a Happy New Year. Okay. And then we wish that this year too, they will not forget about us. We want to thank all companies, all individuals. If you want to mention names, we'll be in trouble. Everybody.
Is there a particular company that has been your major contributor?
Okay, so Church of Christ Ghana, they own the orphanage. Okay. And so they have been our backbone.
Your major, okay.
But apart from that, banks, and a lot of banks. I want to mention one bank's name. I
don't want to give you that problem at all.
A lot of banks, individual companies, and we want to say God bless them.
God bless them indeed. So your final words?
We'll just say thank you for having us here. And if you want to save lives, serve humanity like we are doing at the Village of Hope, just join us, partner with us, and we'll do wonders. We're getting kids off the streets. They are learning a trade. We are making them. We're just training them to be human beings, not just people who just roam the earth, but human beings. Yeah.
All right. Thank you very much for coming, and I wish you all the best. I'll be praying with you, and I will send in my contributions as well. I've been having this conversation with Araba Amoisi Ejay. She's Deputy Group Managing Director, and Kweku Sakode, Deputy Group Managing Director for Village of Hope. They want your support to take care of the children who have nobody in this world.